on the coronavirus, and it is not good news. Startling numbers across the country have experts and state officials increasingly worried about a second coronavirus wave right now amid continued reopenings, protests, and a quickly approaching summer. According to data compiled by the New York Times, cases are still on the rise in 22 states, mainly in the country's Sunbelt region. Arizona, Texas, and Florida are all seeing their highest numbers yet. Today, there have been more than 2.1 million confirmed cases in the U.S. and more than 116,000 Americans have died from coronavirus that we know of. The spike continues to slow reopening plans across the country. Officials in Houston are now warning that a lockdown might be reimposed as cases spike there. New York Governor Andrew Cuomo is threatening to reverse openings after images like this surfaced of maskless New Yorkers gathering outside of bars, produced 25,000 complaints against these businesses and communities for violating Phase 1 protocols. For more on what's happening in Arizona, we turn to Tucson Medical Center physician Dr. Matthew Hines. He served as the Director of Provider Outreach in the Office of Intergovernmental and External Affairs under the Obama administration. First, take me through what's going on in Arizona. I have anecdotal stories about not a lot of masks being worn, but take me through what's happening, especially inside the hospitals.
Sure. It's really scary on the ground here. We have, I would say in southern Arizona, we have close to no ICU beds at all. We're definitely into that surge capacity that we've heard folks talk about. But remember, to get surge ICU beds and surge hospital beds, you need to have more nurses. You have to have staff to actually treat the patient. So we're in a pretty critical situation here in terms of the numbers, especially of our critical beds.
I believe Donald Trump has said in the last hour that if we stop testing, the numbers would go down. I imagine if you're inside a hospital, that doesn't do you much good. When somebody is sick, you know that they're sick, you know that they're positive, and you know they need help. When New York City was in this situation that I think you're trying to describe, it was described by the New York Times as apocalyptic. What is the reality right now for healthcare workers on the front lines in Arizona?
It's a really high stakes. We're all, the nurses and respiratory therapists and other physicians I work with are amazing people. Everyone's going to keep showing up, and we're all going to keep, doing what we need to do to help everybody we can. But when you get to the point where you physically don't have space or you don't have adequate numbers of nurses to staff beds, then, things get really, really tough. It puts all the healthcare workers in a really, it's another stressor where it's already stressful enough being in a situation where at any moment you could contract a potentially fatal virus. But then adding in mismanagement of the state. I was listening to your opening, and in fact, the state of Arizona is not slowing its reopening in any way. Our governor opened the state on May 15th, and we have been just going like gangbusters. The movie theaters are open now. Gyms are open. Golf, of course, that's something you can go do. And it makes no sense because here we are in the hospitals trying to keep people alive, many of them on ventilators, filling up almost all of our ICU beds. And what we need from the governor, what we need from our leadership is an acknowledgement of this, and maybe require everyone in the state to wear masks in public, because they don't right now. It seems like nobody's taking it seriously, and it's really hard to see that and go into work every night for my night shift and then see people running around, not social distancing, not wearing masks. And it's hard to kind of reconcile those things. And when our political leaders don't set a good example, as we've seen with the president and the federal response, if you can call it that, then, we have problems.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.